Welcome to this pharmacology quiz on antiviral drugs, part of our pharmacology quiz series. In this video, we'll test your knowledge of key antiviral agents used in managing conditions such as influenza, herpes infections, hepatitis, and HIV or AIDS. This quiz features 20 recall-type multiple-choice questions designed to strengthen your grasp of antiviral pharmacology. Each question comes with 5 options, followed by the correct answer and a brief explanation to reinforce understanding. The video will pause for a few seconds after each question, allowing you time to think and choose your answer before the correct option appears. So, let's get right into it. Question 1. Which of the following best describes the mechanism of action of acyclovir? Option A, inhibits viral RNA polymerase. Option B, blocks viral entry into host cells. Option C, inhibits viral DNA polymerase after phosphorylation. Option D, prevents viral uncoating. Option E, inhibits reverse transcriptase directly. The correct answer is option C, inhibits viral DNA polymerase after phosphorylation. This is because acyclovir must first be phosphorylated by viral thymidine kinase and then inhibits viral DNA polymerase, halting replication of viral DNA. The other options describe mechanisms of action of different antiviral classes such as RNA polymerase or reverse transcriptase inhibitors. Question 2. Which of the following statements about amantadine is not true? Option A, it inhibits viral uncoating by blocking the M2 ion channel. Option B, it has activity against influenza A but not influenza B. Option C, it may cause CNS stimulation and insomnia. Option D, it inhibits neuraminidase in influenza viruses. Option E, resistance develops rapidly during therapy. The correct answer is option D, it inhibits neuraminidase in influenza viruses. The explanation is that amantadine acts by blocking the M2 ion channel to prevent viral uncoating, not by inhibiting neuraminidase. That mechanism is characteristic of other antivirals like oseltamivir and zanamivir. Question 3. Which of the following antivirals is not active against herpes simplex virus? Option A, acyclovir. Option B, ganciclovir. Option C, valacyclovir. Option D, oseltamivir. Option E, penciclovir. The correct answer is option D, oseltamivir. The reason is that oseltamivir targets influenza virus neuraminidase, not herpes viruses. All the other options are nucleoside analogues effective against herpes simplex virus. Question 4. Which combination of antiviral drugs is most commonly used for HIV post-exposure prophylaxis? Option A, zidovudine plus lamivudine plus efavirenz. Option B, acyclovir plus oseltamivir plus ribavirin. Option C, entecavir plus sofosbuvir plus imipravir. Option D, tenofovir plus ribavirin plus boceprevir. Option E, ganciclovir plus amantadine plus zidovudine. The correct answer is A, zidovudine plus lamivudine plus efavirenz. The explanation is that this combination of antiretroviral drugs is commonly used for HIV post-exposure prophylaxis because it effectively targets different stages of the HIV life cycle, reducing the risk of infection after potential exposure. The other options are not suitable because they target viruses other than HIV. Question 5. Regarding nucleoside reverse transcriptase inhibitors, NRTIs, which of the following statements is correct? Option A, they require phosphorylation to become active. Option B, they inhibit viral protease. Option C, they act only on DNA viruses. Option D, they cause rapid viral release. Option E, they block viral entry receptors. The correct answer is option A, they require phosphorylation to become active. The explanation is that NRTIs need to be phosphorylated within host cells before they can inhibit reverse transcriptase. The other statements are incorrect because they describe the mechanisms of protease inhibitors or entry inhibitors, not NRTIs. Question 6. Which antiviral agent is not used in the treatment of hepatitis B infection? Option A, entecavir. Option B, lamivudine. Option C, tenofovir. Option D, sofosbuvir. Option E, adafovir. The correct answer is option D, sofosbuvir. This occurs because sofosbuvir specifically targets the hepatitis C virus by inhibiting its RNA polymerase enzyme. The remaining drugs are nucleotide analogues active against hepatitis B virus replication. Question 7. The mechanism of action of sofosbuvir involves inhibition of which enzyme? Option A, NS3 protease. Option B, NS5B RNA-dependent RNA polymerase. Option C, reverse transcriptase. Option D, DNA polymerase. Option E, integrase. The correct answer is option B, NS5B RNA-dependent RNA polymerase. This is because sofosbuvir acts as a nucleotide analog that directly inhibits the NS5B enzyme in hepatitis C virus, blocking viral RNA synthesis. The other options correspond to enzymes involved in HIV or DNA virus replication. Question 8. Which of the following antivirals acts as a pyrophosphate analog and does not require activation by viral enzymes? Option A, foscarnet. Option B, acyclovir. Option C, ganciclovir. Option D, zidovudine. Option E, ribavirin. The correct answer is option A, foscarnet. The explanation is that foscarnet mimics pyrophosphate and directly inhibits viral DNA polymerase without the need for phosphorylation. The other antivirals require metabolic activation by either host or viral enzymes to become effective. Question 9. Which of the following statements about amantadine is correct? Option A, it blocks viral uncoating by inhibiting M2 protein. Option B, it inhibits neuraminidase. Option C, it is active against all influenza strains. Option D, it acts as a thymidine analog. Option E, it is primarily used for cytomegalovirus. The correct answer is option A, it blocks viral uncoating by inhibiting M2 protein. This occurs because amantadine targets the M2 ion channel of influenza A, preventing the release of viral RNA into host cells. The other statements are incorrect since amantadine does not act on neuraminidase or thymidine pathways and lacks broad influenza coverage. Question 10. Which antiviral drug is not correctly matched with its primary use? Option A, acyclovir, herpes simplex. Option B, zidovudine, HIV infection. Option C, oseltamivir, influenza A and B. Option D, ganciclovir, hepatitis C. Option E, ribavirin, respiratory syncytial virus. The correct answer is option D, ganciclovir, hepatitis C. This is because ganciclovir is used primarily to treat cytomegalovirus infections, not hepatitis C. The other drug-disease pairings accurately reflect their principal therapeutic uses. Question 11. Which of the following agents is a protease inhibitor used in the management of HIV infection? Option A, efavirenz. Option B, ritonavir. Option C, lamivudine. Option D, zidovudine. Option E, enfuvirtide. The correct answer is option B, ritonavir. This is because ritonavir inhibits HIV protease, preventing cleavage of viral polyproteins and producing immature, non-infectious viral particles. The other drugs belong to different antiretroviral classes such as NNRTIs, NRTIs, or entry inhibitors. Question 12. Which antiviral is not used for the treatment or prophylaxis of influenza? Option A, zanamivir. Option B, oseltamivir. Option C, amantadine. Option D, rimantadine. Option E, ribavirin. The correct answer is option E, ribavirin. This occurs because ribavirin is used to treat respiratory syncytial virus and hepatitis C, not influenza. The other agents are specifically approved for influenza prevention and treatment through neuraminidase inhibition or M2 protein blockade. Question 13. Which of the following antivirals is most likely to cause nephrotoxicity and electrolyte imbalance? Option A, foscarnet. Option B, acyclovir. Option C, valacyclovir. Option D, ganciclovir. Option E, lamivudine. The correct answer is option A, foscarnet. This is because foscarnet can cause significant nephrotoxicity and disturbances in calcium, magnesium, and phosphate levels due to its pyrophosphate analog structure. Other antivirals rarely cause such severe renal and electrolyte complications. Question 14. Which antiviral drug is used in combination therapy for hepatitis C infection and acts as an NS5A inhibitor? Option A, ledipasvir. Option B, ribavirin. Option C, acyclovir. Option D, foscarnet. Option E, entecavir. The correct answer is option A, ledipasvir. This occurs because ledipasvir inhibits the NS5A protein essential for HCV replication and is commonly combined with sofosbuvir. The remaining options act through different pathways or are used for other viral infections. Question 15. Which of the following statements about zidovudine, AZT, is correct? Option A, it is an NRTI that inhibits reverse transcriptase. Option B, it is a protease inhibitor used for HIV. Option C, it causes nephrotoxicity as a main adverse effect. Option D, it acts as an integrase inhibitor. Option E, it prevents viral entry into CD4 cells. The correct answer is option A, it is an NRTI that inhibits reverse transcriptase. The explanation is that zidovudine acts as a thymidine analog, inhibiting reverse transcriptase and terminating viral DNA chain elongation. The other options describe unrelated mechanisms or adverse effects not associated with zidovudine. Question 16. Which antiviral is not associated with bone marrow suppression? Option A, zidovudine. Option B, ganciclovir. Option C, interferon alpha. Option D, acyclovir. Option E, ribavirin. The correct answer is option D, acyclovir. This is because acyclovir generally has a good safety profile with minimal hematologic toxicity. The other agents can suppress bone marrow, leading to anemia or leukopenia during prolonged therapy. Question 17. Which antiviral drug acts by preventing viral fusion with the host cell membrane? Option A, enfuvirtide. Option B, zidovudine. Option C, efavirenz. Option D, ritonavir. Option E, oseltamivir. The correct answer is option A, enfuvirtide. This occurs because enfuvirtide binds to the HIV GP41 subunit, blocking the fusion process and preventing viral entry into host cells. The other drugs target reverse transcriptase, protease, or neuraminidase rather than the fusion step. Question 18. Which of the following drugs is not recommended in pregnancy due to teratogenic effects? Option A, ribavirin. Option B, lamivudine. Option C, zidovudine. Option D, oseltamivir. Option E, tenofovir. The correct answer is option A, ribavirin. The reason is that ribavirin is highly teratogenic and contraindicated during pregnancy due to its interference with RNA metabolism. Other listed antivirals are considered safer and may even be used to prevent maternal-fetal viral transmission. Question 19. Which antiviral agent is classified as a non-nucleoside reverse transcriptase inhibitor, NNRTI? Option A, efavirenz. Option B, lamivudine. Option C, tenofovir. Option D, zidovudine. Option E, adafovir. The correct answer is option A, efavirenz. This is because efavirenz binds directly to reverse transcriptase at a site distinct from the nucleoside analogues, causing enzyme inhibition. The other options belong to the NRTI or nucleotide analog groups and work through different mechanisms. Question 20. Which statement about interferon alpha is correct? Option A, it enhances host immune response against viral infection. Option B, it inhibits viral neuraminidase. Option C, it blocks viral uncoating. Option D, it is a protease inhibitor. Option E, it acts only on DNA viruses. The correct answer is option A, it enhances host immune response against viral infection. This occurs because interferon alpha boosts the activity of immune cells and induces antiviral proteins that inhibit viral replication. The other options describe specific antiviral drug mechanisms rather than immunomodulatory actions. Conclusion. That wraps up our revision on the pharmacology of antivirals. I hope this quiz helped reinforce your understanding of key drug classes, mechanisms, and clinical uses in managing viral infections. For further reading, I recommend exploring Katzung and Trevor's Clinical Pharmacology, Rang and Dale's Pharmacology, and the British National Formulary, BNF, for up-to-date and detailed insights. Keep building your pharmacology knowledge, and don't forget to subscribe for more learning quizzes and revision sessions to keep your clinical skills sharp.